most welcome. We have seniors here. I am thankful to Dr. K.V. Rajendra, one of our senior most orthopedic surgeons who has come. Dr. Uday Kumar is here. Our senior neurosurgeon, Dr. Lakshminarayanan is here. Dr. Kiran Prasad is here. Please.
So pain is a necessary thing because it modifies the patient behavior so that healing can happen. But unnecessary pain and extreme pain like burns and these things, cancer should be controlled. It's sad to see that India is producing but India is not using. I mean that we were talking about bridging the gap between bench and bedside. Now we should bridge the production and people. So this is the irony of present situation. Maybe the nitty-gritties of policy making should ease it out. And also I would say that government should take moral responsibility for all the cancer pains and start an initiative to do palliative therapy, because the pollution, pesticide, preservative, plastic paint and even coronavirus and COVID injections all causing turbo cancers is a government responsibility, government doing. So cancer alleviation, palliative therapy should be the responsibility, otherwise government will suffer karma, I'll say. One last question I want to ask is, sir, pregabalin was a wonder drug which got publicized very much, but later we got to know that in the production there are some toxic byproducts which are happen. I mean they get produced, and purification is a very important step in pregabalin. And many patients are developing complications like SLE and addiction because of these toxic byproducts. Is there any manufacturing procedural problems with nalbuphine is one thing, because we have a lot of newer drugs. Recently what I observed is heparin thrombolizes everybody, but tenecteplase doesn't thrombolize a person with black iris. So this is the duality of genetics and the newer drugs. So what's your opinion on that, sir?
Dr. Saxena, I would like to answer that.
See, normally generic drugs, but they come into it and you have your L1 procedure for tender and use over there till the doctors have the experience to use the product. But purification is important with pregabalin, and there are patented processes for it, and we don't get any problems with export of the product. We don't do much in India. So it's a synthetic process and you have to reduce the impurities and have the product, what you face in this. So I would suggest just have any pregabalin from a good company, whoever it is. Right?
No, sir. Is there any similar issue with nalbuphine? Nalbuphine production.
Banu, he answered that in the beginning of his talk. The product which is exported to the United States with the FDA clearance is the same product you are selling. Yes. That he has made it clear.
Right.
Yes, you are true with pregabalin. We have seen not every brand works the same way. So you have to choose your brand with your experience.
I can just give you an answer what is happening in India without criticism of CDSU or anything. We are the originators of buprenorphine, right, in India, and we have a process as patented, but the government after that does not do any bioequivalence study or anything for any generic drug. We are talking of our case. So when we synthesized the product and the formulation and India approved the drug, then we went to Europe and we did the bio study over there to the multinational product. And the multinational product, we were supra available 175%, and you cannot register the product. So we had to spoil our product, add various lactose and excipients. Efficacy came down, and we are registered in 14 countries in Europe. But the product is useless because the dose goes to 24-32 milligram per day, in India, the dose with our product is 4 milligram per day. So it's buprenorphine has 120 isomers. Now the government of India will not, in Punjab they do a tender, whoever is L1, or even here in Nimans, when earlier they worked with our product, and after that the L1 comes in place, so they spoiled their budget, and finally Pratima Murthy had to write to us that you provide the product for treatment. Right? So there are a lot of these kind of things, and the government has to do a bioequivalence study or something like that, but they are not forced in a proper. So you have to look, every company will have its own major USP, good company, and you have to select those products.
Dr. Kiran wanted to talk. I have a question for Dr. Madonna. Like, you are in a big corporate setup where you have a good pain management